Hi, everybody. My name's Nate Treloar. I'm president and co-founder of a company called Orbita. You've heard us mention a few times this morning. We are a software company based here in Boston, a proud sponsor of this event today, so happy to see everybody out. We develop technology for the healthcare industry that helps our customers, who are healthcare providers, providers to the space, service providers, pharmaceutical companies, payers, tap into the next generation platforms like Amazon Alexa and others to basically deliver new forms of digital experience and digital healthcare to their patients and to their provider. So I'm going to start out in a kind of unconventional way with an apology. And I'm going to apologize for the choice of the phrase big data up there. That's so 2015. I'm just so sorry about that. I don't know how it got in there. I'm not going to say much about big data, except to the extent that it might inform what I want to get across at the very beginning, which is really to add some fine points to the question, why voice in healthcare and why now? So we've heard from a few folks this morning that made the great points about why this is the time to be thinking about voice. So I'm going to add a few points on that, and certainly big data has something to say to that. But mostly I'm going to talk about what we're doing and what some of the use cases are that are out there in voice, some real examples. And my intention isn't to cover the full gamut of everything everybody's doing in healthcare. I'm going to touch on sort of the categories of where people are applying it, what we're seeing at Orbita among our clients, and also kind of put them into a set of categories. And then finally, I'll talk a little bit about sort of what's coming, what we see that's coming next, and where some of the opportunities are. And then I have a few slides at the end that I added after listening to Brett talk, because I really liked one of his slides, but I wanted to add something to it. So hopefully we'll have time to get through all this. So we're pattern finders as humans, and most of the employees at Orbita are human, so we're also pattern finders. And this has been mentioned, but the way we consider the voice technology wave is really the third wave of digital health. If the first wave was 20 years ago, more or less, with portals and the development of websites for healthcare, the second wave being mobile apps that served the needs of patients in the mHealth category, we think we're in this new phase of smart assistants. And what's the difference? The main difference is a word that I'll talk about at the very end, modality. And modality is just what are the mechanisms that you have available to you to interact with the information that's served up through this digital experience. Voice is the new modality. And we've seen it through all the sessions in the morning of why it's become dominant. But from our point of view, the way we see it is it fits into healthcare in a particular way. How many people are familiar with the triple aim of healthcare? Okay, just a few of you. That's just a way of organizing sort of the goals writ large of healthcare. And they fall generally into three categories of improving the patient experience, improving outcomes, and while also reducing costs. And I didn't make this up, but what is new is this new kind of spin on it, which is called the quadruple aim of healthcare. And I bring this up because the fourth aim is improving the clinical experience. We heard from a few folks this morning about one of the challenges that exists in clinical settings of clinicians not having enough time. And it's the experience of being able to serve your patient while you're also trying to type information into a medical record system has compromised the quality of life and work for clinicians. So it's become the fourth of the quadruple aims. So I bring this up because what we're seeing, and this is again from Orbita's perspective and probably generally true across the board, is these applications of voice are falling into generally two categories. There are other ways you can slice it, but these are the two that we see. One is patient-facing applications that are designed to improve the way a patient is engaged with their own health, whether empowering them to be more aware of the condition that they have, aware of their medication, to be more engaged in life for isolation purposes, or avoiding isolation purposes. On the other side is that clinical efficiency, using voice as a tool to improve the lives of clinicians by giving them more time to practice their craft. giving them more time to communicate with a patient versus trying to look things up or accessing and adding data to the system. So these are two general categories, and when we go through the use cases, I'll kind of make a distinction between the two of them. The other way to slice it is you have consumer-facing applications of voice. Those are the things that you can get when you bring an Amazon Echo home and you install it for the first time. You can ask WebMD a question. You can ask the Mayo Clinic a question. You can get information about health, up to a point. The other applications are around taking those devices and putting them into a care setting, whether it's in a residential home or in an individual's home themselves who is struggling with a chronic condition like John's use cases from CCA, or actually in a clinic, in a hospital. So patient engagement. What is patient engagement? Well, ultimately, the definition is really being engaged as a clinician with a patient or the patient being engaged themselves. There's kind of two spins on it. And the way we look at it is if we take the mobile health world as an example, one of the intentions of the mobile health was to put into the hands, literally into the hands of a patient, the tools that they needed to improve or manage their health. And this little chart is just showing the evolution of mobile health apps in the App Store. It's kind of plateaued a little less than 50,000. But what's interesting about this statistic isn't up here is that among those apps, less than 7%, I think it's like a little, maybe it's right about 7%, are being used on a monthly basis. So the level of engagement in mobile apps and mHealth applications is quite low. And this problem exists not just in the mHealth world, but in devices. Everybody's heard the apocryphal story, and it's not apocryphal, it's the actual story of people buying Fitbits, having them for 3 months, and then putting them in the side drawer. It's not true for everybody, but the rate of engagement, the rate of retention, if you will, is quite low. And that's a problem. It's a problem if you believe the power of digital health. How do you keep people engaged? So one of the problems that we want to solve is engagement. And one of the promises of voice is that it has potential to improve engagement. So some anecdotes. I have actually more photos, but I can't show them all because for actually HIPAA reasons. But these are people that I've either personally engaged with around voice or have been users of solutions that Orbita has powered in the past, just a couple. And you'll note that there's an Amazon Echo in both these pictures here. I think there's one there, and there's one over here. So Arthur in the upper left, as you can see, or maybe guess, is vision impaired. And this was the epiphany moment for me. It was when I loaned him an Echo a couple years ago. And I said, I'm just going to loan it to you. He's a friend of my parents, lives across the hall. I'll come back and see how it's going. I came back 2 weeks later, and I said, how did it go? And on no uncertain terms, he said, it's changed my life. Well, you stop and think about it. You can't see. And Art is pretty technically competent. He had Siri on his phone, but he said, well, I don't have my phone here. I can't interact with it. So little things like being able to check the weather before he goes outside with a seeing eye dog, getting the Patriots score, playing some Willie Nelson. These are things that he could do. So it changed his life in a very personal way. Yvonne on the lower right is one of the residents with one of our partners, Libertana. And she uses it to basically communicate with a care team, check her schedule. It's basically a concierge app. Same experience. It's really had a big impact on her life. Why? Well, in the case of these two individuals, and it's a common pattern, their ability to engage with this digital technology it was an improvement on the other options that they had available to her. In the case of Arthur, his smartphone worked well enough when he had it in the room or had it near him or he could find it, but it wasn't a substitute to an always-on, always-listening device. And actually, I do want to make this point. I meant to make it at the beginning, that the phase we're in with smart speakers and voice assistants, in my opinion, is as much the form factor of an Amazon Echo as it is the speech recognition technology and everything that has gone into cloud computing, big data. The far-field microphone arrays that are on these devices are an innovation with signal processing that allows you to have these sort of hands-free distance experiences. That's transformative. There's a reason why when the end of 2014 came around and the Amazon Echo was introduced that all of this happened. And it's not just because of speech recognition, it's the form factor of an always-on, always-listening device, and the signal processing and everything else that goes into it. So some comments that we've heard, and this is very much a subset. I already mentioned one of them, Alexa's changed my life. I particularly like this one that, I think it might have been Yvonne who said, I know she's a robot, but I think of her like a person, right? And this is a common one. Cognitively, they recognize that it's just a technology. But the temptation, the human temptation, particularly if you're isolated, to personalize Alexa is a real thing. And you see it in the elderly in particular. There's technology companies out there that are making little stuffed animals. I think Hasbro has one, right? And it doesn't talk yet that I know of, but it moves empathetically and it wiggles in your arm, and it's very successful. I was with my mom just a couple days ago, and she's in a nursing facility, and a good 2/3 of the people there now have stuffed animals that they carry around. And they're very important to them. And the point here is that even though we might think of Alexa as just a technology, there is a temptation for certain people to give her a personality. Alexa's my friend. The other one I like is this idea of Alexa actually trains you. You learn to speak in a different way. And I think this is not something that to be understated. Technology trains us. We all learn to use smartphones and use the touch screens. We learn how to type. We're learning how to speak to these voice assistants. We adjust our cadence. We speak louder. It's a back and forth. We're a very adaptive species, and we adapt to technology. And that holds promise for how we can take these kind of things forward. So let's get into some use cases. One of the earliest ones that we got into were sort of those those organizations who are kind of kicking the tires. We want to understand what are the possibilities for voice. And most of them are going out there and trying to build a voice skill for the Amazon Alexa store or for the Google Assistant store. This is the Mayo Clinic, and the Mayo Clinic's Global Business Solutions team, they're a service provider to the healthcare industry. They provide content. You can go to the Mayo Clinic's website and you can look up information about how to treat a sunburn and how to remove a splinter and things like that. And they recognize that their own website and their other digital channels are channels. They're digital marketing channels for their content. And they wanted to look at voice, and do look at voice as another digital channel. How do you reach the 20 million people who have bought Amazon Echoes, 20 million plus? Well, one way you do it is you put a skill up in the skill store. So what was interesting about what we did with the Mayo Clinic is you don't just take a 2-page description of how to treat a sunburn and stick it into a voice skill, right? So if you went to the website and you asked, how do you treat a sunburn? She could read for 5 minutes, and that's not a good experience. So as a general kind of pattern, what we're seeing in these patient education applications is taking traditional digital content and putting into a voice experience is a process. It's a process that involves some thought. And Romina, I'm sure you guys went through it. It's kind of rolling your eyes. I mean, it is something that you do need to plan for. But this is a pretty common use case. We call them these sort of information services. And they exist not just in consumer applications like this one, but inside the firewall. And I'll talk about an example in a second. But you'll note that the conversation that happens is not transactional. I was interested when Brett showed the list of all the different types of interactions that people use with a voice experience. Most of them are very transactional. What's the weather today? What's the traffic today? It's not a conversation, right? And conversation requires context. So, when we talked about knowing information about the user, that's knowing context, so you can create a highly personalized experience. So that's one example. Another one is this Concierge service. This one is a fairly generic one, exists in both residential care settings, et cetera. We did a project last summer with Libertana, and their focus was, how do we help our residents have access to the information they need so that they know what's going on in the facility, but we can also be aware of their needs and be able to respond in a timely fashion. The intention wasn't to create a personal emergency response system. I've fallen and I can't get up. It was really, let's create an experience that addresses loneliness and isolation. And this list here is actually from their case study of all the things that they observed. They didn't quantify everything, but they observed all these sort of benefits from a voice experience. And then I think maybe it was Lori that mentioned some of the studies that are going on right now, have gone on. Social isolation is a cost to Medicare. That population that tends to be qualified or quantified as socially isolated represents a $6.7 billion supplemental cost to Medicare. So solving social isolation is a big problem, an important one. That's from a study done by the AARP that came out, I guess, end of last year. Another one that we're also seeing, it's an interesting one because it's voice paired with a device, and we have several of these going on, where the device is maybe a scale or a blood pressure monitor, or in this case, what's called a respiratory muscle trainer. And the respiratory muscle trainer, you breathe in, you breathe out, it has resistance, and it's designed to sort of support people who have COPD or other pulmonary conditions. So the device itself, there's an analog version and soon to be a digital one, it can record information. If it can't, it can also be augmented with a voice experience that will guide the patient through the treatment, through the therapy. Start your session. All right, don't forget, you're going to breathe in for 2 seconds, breathe out for 2 seconds, and at the end, it will ask you, how did it go? And you can report qualitatively, and if the device is connected, it can report quantitatively. And what's important in this is you can have this sort of feedback where the data coming from the device makes it into the application, and the voice assistant can come back and say, hey, I can tell you're doing really well, keep up the good work, or I noticed you've tapered off a little bit in the volume. Don't forget to be sure your posture is good, et cetera, or in some cases trigger an intervention if there's some indication of decrease in performance. So we're starting to see more of these health coach type of applications. Kind of shifting a little bit more onto the clinical side. Clinical trials are very expensive, and they're happening all the time. We have a number of projects with pharmaceutical companies who are looking at voice-assistive technologies as a way of augmenting how data is collected and how patients are engaged through a clinical trial. And the reason they care about this is, one, it's a way of recruiting patients is to give them a device, an Apple Watch, an Amazon Echo. It's also a way of making sure they stay in the program. So engagement matters. If they're engaged in the program, then they're more likely to complete it. The data collection is better. The data quality is better. All these things reduce the overall cost. And what's interesting is one that's sort of underappreciated is that if you can automate some of the data collection and engagement, then you're saving quite a bit on administrative costs. So you can see why this is an important thing for pharmaceuticals and other organizations that are in the clinical trial space. So we've done a few projects, and this is an example of a clinical trial application, fully HIPAA compliant. But one of the more common use cases is patient assessment. And why is this HIPAA compliant? Well, one, our platform is HIPAA compliant, and two, it's not using Alexa. It's using a smartphone with a voice interface on it. So our technology is designed to kind of deconstruct the components that go into a voice experience so we can make sure that we're securing and we're also getting all the paperwork we need in order to be HIPAA compliant, which are these business associates agreements, et cetera. But what this does is it demonstrates a couple things. One, it allows a person in a clinical trial to do their daily assessment survey in a hands-free way. But also, if they want to, they can do it with their hands. They can swipe. There's all kinds of different gestures that they can interact with it. And the whole point is to remove the barriers to engagement so that they can do their daily assessment or their weekly assessment with the regularity and with periodicity that's required. And so, what we've done in response to what we see as the need is recognize, as Brett said, that the smart speakers are one way of delivering a voice experience, but they're not the only one. You can do this in your car. You can do it on your smartphone. Eventually, you'll be able to do it on an Amazon Echo. Hopefully in the next 6 to 12 months we'll find out. I don't have any special information, I'm speculating, but we do believe that Amazon will come out with a HIPAA-compliant version of Alexa not too far out. Here's another one I kind of alluded to before. Patient education doesn't happen just in the home. Sometimes there are situations where you want to make sure a patient is fully educated or as educated as possible before they go home. It's a project we did with a hospital in the Midwest where a patient is coming out of surgery. It was actually a dermatological procedure. And if you know how this works, there's a discharge nurse or a nurse that's part of the discharge process, and they sit down with the patient and sometimes a family member, but not always, and say, okay, you just had surgery. Here's what you need to know. Here's the stack of paper that's going to tell you how to treat, manage your recovery. And that's discharge nurse is usually very busy. They have 5 minutes, then they got to go on, and they're talking really quickly, and the patient meanwhile is under anesthesia maybe. It's not a great experience. It often isn't a great experience. So the program here was to augment the discharge nurse with a voice assistant. So the discharge nurse actually sat with the patient and said, here's an assistant. You can ask the assistant, the digital assistant, questions after I leave. And they let the patient stay in the room. They didn't take the device home. It just stayed in the room. And they could ask any question and walk them through things like, all right, when can I take a bath? After 24 hours you can bathe. What should I do if I'm in pain? How do I know if it's infected? All those questions were sort of built into the experience. And importantly, what they found was the patients loved it because they didn't feel the ego of the discharge nurse in the room. The discharge nurse loved it because they could just kind of set them up and kind of gently walk out of the room and do their next job. So we believe these kind of clinical efficiency use cases are going to be more prevalent. I'll make the comment that others made that this year, 2018, has really been the year of pilots, particularly for clinical use cases. We expect to see quite a few be in production next year. One data point, this is a similar study that was done by a partner of ours, Worrell. They did what's called Instructions for Use Comprehension Study, IFU. And so similar concept as the discharge one, but in this case it was individuals who had been recently diagnosed with type 2 diabetes. So they sit down with the patient and say, all right, you've been diagnosed with type 2 diabetes, here's your brochure on how to treat your condition, how do you monitor your blood sugar, good luck. So they did a test where they did a kind of a comparison between the written instructions for use with written instruction for use augmented with a voice assistant. And what's interesting is that out of the gate, the individuals spent more time with a voice assistant, which kind of makes sense. Typically what happens, you get that brochure, you kind of look at the back, you look at the front and say, I got this. Stick it in your back pocket and never look at it again, maybe. So you don't spend as much time with it. What's the most important thing is their adherence to those instructions was much higher for those individuals who received the instructions through a voice assistant. So they retain the information, the assumption is, and they're able to adhere to it more consistently. And lastly, what I think is interesting is their overall confidence level after they received the instructions was lower for those who received it through the voice assistant than it was for the ones who just read it. And not a lot of kind of investigation into this that I've seen, but our assumption here is that the ones who read the brochure literally just said, I got this, right? And dropped it back down on the table. So, once you get all the information and you've heard it all, it can be kind of intimidating. And so it's not necessarily a bad thing that those patients who received it through the voice assistant weren't feeling particularly confident. It just means they're more likely to adhere. So another one that's sort of emerging is this idea of a sort of an augmented call center where there's a voice assistant delivered through any kind of device like you see here, where they enter into a conversation with the digital agent, and then at some point the digital agent says, I don't have the answer, and it relaxes to a call center, and actually opens up a channel of communication. I bet you we have half a dozen active projects that are just like this. And the interesting thing about it is how different is that from an IVR system where you call up a number and say, listen carefully, because our menu options have changed. Like you care, right? But importantly, what I typically do is I just say agent, agent, agent. What we want is an experience that's quite improved on that. So this is a pattern that we're starting to see emerge. And of course, it means connecting into call centers on the back end. Member services, patient services, we consider them interchangeable. All right, so that's enough on sort of, there are many more use cases. I'm happy to tell you some of the other projects we're working on, but sort of those are the categories. We have sort of the patient-facing engagement ones, clinical use cases. An area that we're not really in, but has been mentioned, is sort of the holy grail, right? Is how do you improve the lives of clinicians who are trying to serve the needs of a patient, but are spending most of their time trying to fill in the forms that they have. And there are companies that are doing this right now. Nuance was mentioned. I think Emilio from Robin is here today on the panel, I believe. But we also have startups like Suki that are, all they're trying to do is to improve the lives of clinicians who are trying to treat patients, and by automating the collection of data, automating the retrieval of information that they need to do it on a day-to-day basis. And I'll give a very concrete example. My sister is a dermatologist out in Newton, and when she does her office visits and meetings with patients, she has an assistant with her. And the assistant has the laptop or tablet, and when there's a question about contraindications, the assistant looks it up, literally Googles it or looks it up in PubMed. When there is some information that needs to be captured, like a prescription, the assistant does it. So my sister spent the money to have a human assistant to be in the room with her 100% of the time. And individual practice, she's by herself. It's very expensive. The alternative, of course, the holy grail alternative is to have a voice assistant that can be there listening to the entire conversation, like John was describing from CCA. And capturing that data, getting into the medical record, retrieving information from the medical record and other sources, and basically allowing the physician, the clinician, to be a clinician, to be a human in the process. Another one, we're starting to hear more and more from our customers, and it's more like, can you guys do this? Can you guys? Is using voice and the biomarkers of voice to improve the interaction, improve the experience, or to otherwise inform the care, the health of the care of the individual by recognizing potential health issues. And this technology's advanced considerably. It's an example of where big data has kicked in. So it is possible now with machine learning and pattern recognition to detect whether an individual is in imminent situation of potential stroke or a heart attack, just by analyzing vocal inflection and tone and other affects. There's companies in the Boston area, Sond Healthcare, that do this. There's a company out of Israel that's doing this for heart attacks. So that technology is really about signal processing and machine learning and gathering data and recognizing patterns of changes in inflection is vastly improved. And guess what? Amazon and Google are recording the audio. That audio is there. So you can do this now. We think this is really the next step. Of course, this is a level of personalization and context-based interaction beyond even where we are right now. We talked, there were some questions about how can we tap into the medical records so that the interaction between the patient and Alexa is more informed about what that patient is. Well, that's what digital marketers have been doing on the web and on mobile for dozens of years now at this point. We want to do the same thing generally with voice, and we especially want to do it in healthcare, because if you can say to a patient, are you feeling any pain? And they say yes. Your response to that patient when they say yes may be different depending on who they are. If it's me, they might say, suck it up. If it's Trip, they might say, we're sending the ambulance. Thanks. Right. You're welcome. So context matters, right? So a couple slides that I first showed about 1.5 years ago when we were first getting into this. There are some considerations, and I reordered this since I first presented it. We talked about this already, designing for conversations for transactions. Consider these sort of our learnings, right, at Orbita. It is different. Voice is different. And designing an application for voice isn't just taking a hunk of content, like I said, and sticking it in Alexa. You have to think about what is the interaction? How long can she speak? How do you build empathy into the experience, right? Sometimes you actually encode in the response, okay, or mm-hmm. Remember, that was the example with Duplex from Google. And she goes, mm-hmm, puts in these little pauses. But thinking about that and thinking about it up front is really important. You don't just jump into a voice experience without thinking about that interaction. And by the way, another learning from the field is just writing it down and saying this is what the voice interaction is going to look like is not enough. You got to hear it. You got to kind of prototype it. Because when people will read it, they'll read it and say, yeah, it looks good. But you're reading it, and you're not hearing it. As soon as you hear it, everything changes. Integrating with existing systems is critical and becoming more important as we want to personalize these experiences, whether it's an EHR, a study coordination dashboard for clinical trials. We spent a lot of time at Orbita working on our integration tier because this is so important to not only informing the interaction, but to collecting and securing the data. Also, voice is not the only modality. It doesn't work for everybody. I mentioned my mom. She had a stroke in April. She left hemisphere stroke. She can't speak. She can't use it at all. She can't hear. You can't really interact with it either. So it's not ideal for everybody. And then the last one, sort of we've talked about it a few times, so the big elephant in the room is HIPAA compliance and security. We take it very seriously, but it doesn't mean that we can use Alexa because Alexa is not HIPAA compliant. But there are some things to think about when it comes to security. This is a slide I put together over a year and a half ago. I think there's 2 points to make about this. One, levels of trust vary by individual and by use case. If you're an 85-year-old person living home alone, and you have an opportunity to have an interaction with even a digital device that's going to help alleviate your feelings of isolation, you may trust that more than somebody who's 35 and is generally skeptical of technology, if any of those people actually exist. But my point is we give up a certain amount of, we take on more risk in exchange for some potential benefit. But this slide here, the way I organize it is that degrees of trust are sort of based on how much information is being shared and how much information you're getting back. And those educational applications that are just about answering questions about how to treat a sunburn are on that category. We're starting to see more that are really about interacting, like the LifePod example where it's about sending messages and even proactively sending messages. And then there's levels of engagement where we can interpret the data that's coming through. So that example with the breather, the data that comes back, we can actually use that to inform the interaction and even possibly make a diagnosis. It doesn't take any action, but it might say, this doesn't look good. But the next step beyond that is actually to take some action, recommend something, and then of course the ultimate would be to actually dispense some. And all of these are possible now. In fact, in some cases they are. Automatically dispensing a medication to somebody who's showing some sort of compromised health. All this stuff is possible now. For voice, we're kind of right about here. We're kind of pushing carefully in that direction. And then I'll just end with this. This is a slide I mentioned that I added. Modality is a word you guys should know. Modality speaks to what are the physical ways that you interact with the digital technology. And if you go, you can go further back than that, right? How many people remember punch cards? How many people remember dropping your punch cards? Okay. Punch cards, then typing, then clicking, touch, gesture. This is a Microsoft Connect. You can interact with it by just gesturing. So this is just another modality. We're excited about it because it's one of those modalities that almost everybody has, right? But you know what else everybody has is a brain. And I predict in 10 years we're going to have a whole separate conference where we're talking about brain-to-computer interfaces because this stuff is moving almost as quickly as speech. So we can be excited about speech right now, but when we're thinking and interacting with technology, that's sort of the next level. Anyway, just some thoughts on modality. With that, I will stop. I think I got some time for questions.
Let's give Nate a round of applause. We have time for 2 questions. If there's 2 questions, then we'll get to Terry and then get to lunch.
Awesome. That good. Thanks, Trip.
I couldn't let you off the hook.
Thanks for standing up.
Couldn't let you off the hook that easily, Nate.
I know. This is the hardest question I've ever gotten, I can guarantee you.
No, it's not. So one of the things I think about a lot is that at the heart of the matter is the ability to act on the data, or to act on the voice input, to act on what the patient is saying, to interface with the healthcare system, with your physician, with your lab, with the center, with the hospital, with the urgent care center, whatever. And at the back end of that is a mess, right? I mean, we can't do that now when we physically show up. We can hardly do that through patient portals. They've been a disaster for that. So we've got a part where we can repurpose content and information in those use cases. It's really interesting to me, and the real question comes to what you observed and who you've talked to in terms of use cases. Are there places where you see the opportunity for voice to push back and change the front end of healthcare? Do you see a place where voice begins to be a driver to the workflow, the responsiveness, the ability of healthcare to respond? Because ultimately, that's kind of at the heart of the matter.
Yeah, I think there's maybe at least two perspectives on that. I'll talk about two. One is, voice as an alternate way of getting that initial input, that initial data. And I think we've already kind of beat that horse, is if you can remove the barriers to getting that initial piece of data that you want to act on, then you can act, right? So as a front end, sort of from the patient inward, I think that voice has that potential. And whether it's just getting sort of raw information about how you're feeling today to the more nuanced things about biomarkers that are in the voice itself, right? So that's sort of on the front end. The uniqueness of voice to improve how you act on a situation is a bit informed by that first part, but I don't think it doesn't solve all the problems that exist on the back end, because those conundrums are going to be there. How do you get that piece of data into the EHR in the first place? We, like I said, focus on those points of integration. The place where I think it, on the clinical side, it has some potential is sort of in that sort of hands-free interaction. We're working on a project where in a clinician's office there is a kiosk that allows the clinician in a hands-free way, or the patients in a hands-free way, sort of interact with their EHR data, interact with imagery, like this is what your heart looks like right now. This is the valve that we're going to go work on. So acting on it from the point of view of information sharing is informed that way. I guess there's a third thing, which is acting on information in the moment is not as easy right now. And one of the promises of voice is that you can kind of bring in that data collection into the person's home. It's sort of, how do you know what's going on between episodes of care? It's sort of about the whole promise of mHealth, is that you have visibility. So it's not unique to voice, but it's more of like a home care, being able to act on information between episodes of care. So I don't know if that answered your question, there's sort of three lenses on the problem of ACT. But in the end, we talk about transcription services, or talk about note-taking. None of that it's not just about collecting data. We can collect data till the cows come home. It's how do you act on that data? From our earliest conversations, this is something we've always cared about.
Yes, sir.
A question on regulatory constraints. You mentioned BA agreements in general. Can you comment in general if you see any major roadblocks when it comes to that? So obviously, Alexa is not HIPAA compliant,
right.
But even if you try to put it together from more atomic components like Watson speech to text, there are things that can trip you up. Like most of those services will cache voice samples for training.
Yeah, you have to work with services that are provided by vendors that will sign a BAA. And they exist. So we've deconstructed the technology stack and picked those technologies that will, from vendors that will sign a BAA with us. That's how we, so HIPAA compliance is not just about security, you know, encryption and all the nuts and bolts. It's about business policies, a lot of it. And in order to claim HIPAA, HIPAA compliance isn't even a real thing. It's just complying with the regulations. In order to claim it, you need to have proof that you've got the business associates agreement with your providers. And then so we provide a BAA to our clients, but then our providers also provide BAAs to us. It's daisy chained up.
Let's give Nate a round of applause. Oh, did you want to ask a question?
One more?
You go ahead.
If there's time, I was particularly interested, Nate, great conversation we're having, in your comments about perhaps detecting things like a heart attack or a stroke. And being someone who's a geriatric nurse, I'm particularly interested in dementia, and urinary tract infections are common, and people slide into delirium, and it can be hard to distinguish. And, you know, I'm hoping in the future, I don't know if you see any of this happening now, but it shouldn't be just about monitoring and reacting, but also about predicting, because things develop over time, and we're gathering this data. People start at different levels, so we need to look at intra-individual variations in functioning, but I'm hopeful that we'll see some things that
The
go there.
biomarkers are not just about reacting to something that might be already physically obvious. It's looking for things that are showing indications that something might be happening. They're showing indications of a potential stroke or their depression or dementia, you know, and then I'm not an expert on how they do all the varieties of them, but pretty much anything that you can imagine a human possibly being able to detect would be in that category. Oh, one quick comment on the dementia thing is Alexa for people with Alzheimer's is there's a few studies out there about it where you know, one of the common symptoms of Alzheimer's and dementia is to ask the same question over and over again of your spouse, what day is today? What day is today? And the most patient spouse in the world has trouble dealing with that. But guess what? Alexa doesn't care. You can ask her 1,000 times. And it's important, right? Because if Alexa is going to answer you, Alexa never gets tired. You're not constantly being reminded that you're losing your memory. It reduces anxiety and it actually improves health. So.
Let's give Nate a round of applause.
Thank you.